Retinitis pigmentosa encompasses a set of diverse hereditary disorder that affects the photoreceptors and retinal pigment epithelium diffusely across the entire fundus but begin with the initial geographic changes in periphery or macula. Symptoms: decreased night vision, loss of peripheral vision, loss of color vision. Signs: visual acuity may be normal, contrast sensitivity is affected earlier than visual acuity, bilateral intraretinal paravascular pigmentary changes. Peripheral pigmentation may become severe with marked arteriolar narrowing and disc pallor. Cystoid macular edema, epiretinal membrane and posterior subcapsular cataracts. Investigations: electroretinography, ERG, electrooculography, EOG, perimetry, optical coherence tomography, OCT, genetic analysis. Treatment: medical. Vitamin A, very high daily dose of vitamin A, 15,000 U per day. Beta-carotene, dose of 25,000 IU. Docosahexaenoic acid, acetazolamide, per oral for patients having macular edema. Lutein, zeaxanthine, dose from 6 to 20 mg per day. Surgical: cataract extraction, growth factors, ciliary neurotrophic factors result in retinal thickening, transplantation, retinal prosthesis, gene therapy. Thank you.